Hi, I'm Sarah Carr, and I work at Surry County Health and Nutrition Center. Today I have Julie Pfeiffer here with me, and she is one of our licensed clinical social workers. She's going to be talking about self-harm in our county today. And so welcome, Julie. Would you tell us a little bit about yourself and your background?
Sure. I am a licensed clinical social worker. I have many years of experience, both in clinical work and in leadership, management, quality improvement, consultation with agencies, public and private, across North Carolina. I came to Surry County Health and Nutrition Center in 2012. Mrs. Ainge, who's our health director, had wanted to talk about and try to implement or incorporate behavioral health services within the health department. So we were able to work with her and develop an integrated model. And in 2013, we started providing integrated services, which was an excellent thing for Surry County patients and the medical providers that were receiving service there.
Great. Well, thank you.
Welcome.
I know that behavioral health has been a growing need all around the country, and especially here in Surry County. You know, we have our own needs. So could you tell us, we're talking about self-harm today, can you tell us, some symptoms and what is it?
Okay. Self-harm is a set of behaviors that someone engages in order to cope better with things. It includes things like cutting, scratching, burning, pinching themselves, causing bruising, and it can happen anywhere. It can be on the arms, most predominantly on a non-dominant arm. It can be on legs, thighs, particularly stomach, anywhere that it's easy to hide. Self-harmful behavior is a behavior that is done mostly in secret, and they don't want people to know about it.
So how common is self-harm in the United States?
In the U.S., there's about 17% of the adolescents, those in the teenage years, that self-harm. About 13% is in the young adult population, and 5% in the adult population are those that are over 30.
So who are you finding self-harm with? Is it males, females? What are your demographics that you can share with us about self-harm? Right.
Studies are conflicting in regards to whether it's more female, more male. So it's really no difference. It's kind of that hard to tell. What we do know from research is that females will do it longer. They use more lethal means, or not lethal means, but means to
maybe more dangerous or physically harmful?
Right. Males tend to self-harm when they're altered. They're under the influence of drugs, alcohol, that kind of thing. And also males tend to do it more in social settings.
Almost as a peer pressure response? Okay.
Or around others. But there's no difference in economic status or income status, no difference between ethnic or racial identities.
Thank you. Why do people engage in this?
People engage in self-harm to cope. It's a form of a coping mechanism. It's an unhealthy, maladaptive coping mechanism. But they're hurting.
They're hurting emotionally, and then do they translate that? Is there some kind of maybe emotional release or kind of feeling that they get? Is that a chemical response, or can you tell us a little bit more about?
Sure.
Okay.
Yeah.
Thank you.
It's counterintuitive to think that cutting oneself would actually be of relief, or it makes me feel better. It does. It's a process where called pain offset relief. So I cut myself, I feel pain. Individuals with self-harm do the same thing. They cut themselves, they feel pain. What they're looking for is that time where the pain begins to be relieved. And at that point, that's the pain offset. There is some release. It tricks the brain into believing that there is improvement in that emotional pain. And it's kind of hard to think about hurting oneself would be a way to feel better, but they do.
I mean, a lot of people do. It's not just one person who's figured this out. This is a phenomenon across, a good slice of our population.
Right.
So can you tell us, is this a suicide attempt? I mean, you've spoken about the bad feelings. Can you tell us the difference? Maybe they share similarities, or maybe they're totally different. Can you tell us a little bit about that?
Yes. There is a big difference between suicidal behavior and self-harmful behavior.
Okay.
Suicidal behavior is, and the main thing between the two is intent. What is the intent of that behavior? With suicidal behaviors, it is the intent to die. They don't want to be here. With self-harmful behavior, they're looking for a way to cope. So self-harmful behavior has hope in it. Suicidal behavior does not.
Okay.
There is no hope. Suicidal behavior is one that's very black and white. There is no in between there. There's no gray area. And with self-harmful behavior, we see that hopefulness is that gray area. And obviously maladaptive, unhealthy ways of coping, but
yes, and the intent makes sense, and there also seems to be, maybe if they didn't mean to self-harm themselves, could that lead to suicide? Have you seen that happen where, it just takes a step too far and it was an accidental step, but that's still an irreparable mistake.
It can happen. It's rare that it does. Because most of the self-harmful behaviors are superficial wounds in comparison to suicide attempts.
Okay. Thank you. So how do we treat this? I guess, we've talked about how to recognize it and what risk factors are for it, but, how do we actually go about fixing this problem?
Okay. We want to help by helping them identify what kind of coping skills do they have. Even though we don't want to think of self-harmful behavior as one that's in the repertoire, it is. It's still going to be there even though they have learned and implemented different kinds of coping skills. But we want to see what it is that they're using that's workable, what is helpful, and then we build upon those.
Can you give us some ways or examples that we could, train ourselves to strengthen these coping skills, the healthy coping skills?
So what we want to be able to do is first of all establish a routine of self-care. And what I mean by that is, healthy eating, drinking lots of water, getting good sleep, or a set sleep pattern. We want to be able to get exercise, take care of our physical body so that we can, if we have a good basis of a physical body, we can build on the emotional strengths that we have as well. We want to make sure that that we have outlets to be able to talk about things or write things down or have some kind of resource to where we're getting thoughts out we might not have a counselor or a trusted friend or something like that right there, but I need to get this information out of my head. So you can journal. We want people to find joy, and that can be in anything. Maybe it's hard to find joy right now. If you're in this place where you're self-harming, you're down, you're sad, or you're anxious, if there was something that you enjoyed or had an interest in it previously, but kind of let it drop to the side, you could try that again. You could, just engage in something that you think might make you happy or might make something you might be interested in.
Yeah.
Yeah.
And I like how that ties back to self-harm has a thread of hope in it, you know, and maybe if you can search for something that will give you a little more hope, then you pull that one and then you do another one.
Yep.
So that's a great way to build up.
Yeah.
Do you suggest any kind of meditation? I know there are some apps for that, and that always helps relax me.
Meditation is a wonderful thing. There's been a lot of research in the last years about meditation and what it does for us. It helps increase concentration. It helps us to learn how to breathe. We think we know how to breathe, but to breathe in a way that helps to relax us. It's also can help with sleep, with pain management, and there are multiple apps out there that you can download and listen to, and we recommend meditation with everybody. It's a very effective tool.
Good. And that was something, that you can do on your own. You can do it in the car. That's great.
Right.
And do you have maybe a resource kit or something like, if I was feeling the urge to self-harm, maybe just like a little booklet or something, quick where I can go and either receive help or distract myself? Does something like that exist?
Yes and no. Some of it has to be done by the person to develop their own little toolbox. And so that's one of the things that we do with folks is to help them build that toolbox of different skills to be able to manage distress. But there's also things out there that you can search and find a list of 100 things to do. When you're stressed or when you're anxious, and just do a search, find that, and it's a wonderful list of things to do, and they don't cost money.
Yeah. And that is great, being able to find the resources that you need on the internet, it makes it very accessible. Okay, so as a parent, I would absolutely, I be devastated if I found out that my child was doing this. I don't know if I would know how to help them. So, or if I would even understand, I'm sure that would be a really emotional time for both. So how would you suggest going about this as a parent where you can actually help your child instead of, scaring them or driving them away or making them feel misunderstood? What are your steps for that? Right.
Yeah. You don't want to close down any communication.
Yeah.
You want to be able to have an open communication with your child, and that's the first thing you do. Talk to them as soon as you find out about it, and if you suspect it. One of the suspicions is wearing long sleeves jeans in the summertime when it's 90 degrees outside.
Yeah. Teenagers
don't tend to do that. They tend to wear shorts and sleeveless shirts. But when they're covering up all the time, that's a big indicator something's different.
Yeah.
Talk to your kid. Find out what's going on. If you do find out that they're engaging in self-harm, talk to them about those feelings. Validate those feelings. Even though you may not completely understand what's going on, you can at least understand from their perspective by listening.
Yeah.
And that can be, it can be hard for a parent to find it can be hard for a parent to deal with this, but they know we've got to talk about it.
Yeah.
We've got to figure out what's going on. We've got to get you to help to be able to figure out what's going on, how we can fix it, and move forward.
Yeah. Well, when you mentioned help, can you tell us a little bit about what Surry County Health and Nutrition Center offers? And then if, you know, some of our residents are not patients at our workplace, where can they find resources?
Sure. Within Surry County Health and Nutrition Center, if you're a patient within our pediatric clinic, absolutely call. As soon as you find out, call, make the appointment with your medical provider, and they will get you to myself. Will link you with our care manager, who is Juan Sanchez, and we will begin the process of assessment, screening assessment, figuring out what's going on, and what approach we need to take from there. If you're a patient within the primary care clinic, which is the adult population, and it's your child, but they may see another provider, that's fine. Call us. You're a patient, your family is a patient, so you can still call, get in, and let's see what we can do.
Well, great. Thank you. Do you have anything else to add about this? I'm hoping all this information helps at least one person, you know, either recognize that behavior in someone else, or maybe it helps them, you know, it's their own wake-up call saying, I know this isn't healthy and I want to get help for it. So do you have anything else to add?
I would like to add that within the Surry County area, if an individual is uninsured, there are resources to help you with that if you have a behavioral health need. And that resource you can access by calling Partners Behavioral Health Management. They have a 24-hour crisis line. They also have a number that you can contact to be able to get linked into services. And they have providers that are contracted with them to provide services for folks that are not insured. So that's a valuable resource.
Great. And they could use those resources for something other than self-harm.
Right.
It encompasses any
Any
behavioral.
behavioral. Yeah.
Okay. That's great. Thank you so much for being here today.
Thank you.